Hello everyone, welcome to Nextmeds. Today we are going to discuss about gallstones, a common condition encounter in clinical practice and daily life. Gallstones, also known as cholelithiasis, are small, solid particles that form within the gallbladder, a small organ located beneath the liver. These stones can vary in size from as small as a grain of sand to as large as a golf ball. Gallstones can be made up of cholesterol, bilirubin, or a combination of both. The mnemonic 5Fs is commonly used to remember the risk factors associated with gallstone disease. The 5Fs stand for female gender. Women are more prone to gallstone formation, particularly those who are pregnant, using hormone replacement therapy or taking birth control pills. 40. Gallstone disease becomes more prevalent with age, especially after the age of 40. Fertile. Pregnancy and hormonal changes associated with fertility increase the risk of gallstone formation. Fair, light-skinned. People with fair skin are at a higher risk of developing gallstones. Fat, obesity and being overweight are significant risk factors for gallstone disease. This mnemonic helps to recall the key risk factors associated with gallstones, making it easier for healthcare providers to identify individuals who may be at higher risk for developing this condition. Here are some important factors about gallstones. Found in 24% of women and 12% of men. Prevalence increases with age. Majority, asymptomatic, 10–20% symptomatic. About 10% of people with gallstones have bile duct stones. Let us see the types of stones that can be formed in the gallbladder. Number 1. Cholesterol stones, about 15% of the total, often solitary, more than 2.5 centimeters. Round. Number 2. Mixed stones, about 80% of the total, multiple, faceted, contains cholesterol, calcium phosphate, calcium carbonate, and proteins. Number 3. Pigmented stones. About 5% of the total, those are small and can be black or brown. Here are some important factors about gallstones. 1. About 10% of gallstones are radio-opaque. 2. Biliary infection, stasis, and changes in gallbladder function can precipitate stone. 3. Bile is infected in 30% of patients with gallstones. Gram-negative organisms are the most common infective factor. Clinical presentations. 1. Asymptomatic gallstones. Many people with gallstones do not experience any symptoms and may not even be aware that they have gallstones. These gallstones are often discovered incidentally during medical tests for other conditions. 2. Gallbladder attacks, biliary colic. The most common symptom of gallstone disease is a sudden and intense pain in the upper abdomen, known as biliary colic. This pain typically occurs in the right upper quadrant of the abdomen and may radiate to the back or shoulder blade. Biliary colic usually occurs after consuming a fatty meal and can last for several hours. 3. Nausea and vomiting. Biliary colic may be accompanied by nausea and vomiting, especially if the pain is severe. 4. Jaundice. If a gallstone becomes lodged in the common bile duct, it can block the flow of bile from the liver to the small intestine, leading to jaundice. Jaundice is characterized by yellowing of the skin and eyes, dark urine, and pale stools. 5. Fever and chills. In some cases, gallstone obstruction of the bile ducts can lead to inflammation of the gallbladder or bile ducts, known as cholecystitis or cholangitis, respectively. These conditions may cause fever, chills, and other signs of infection. Diagnosing gallstone disease typically involves a combination of medical history, physical examination, and diagnostic tests. Here's an overview of the diagnostic process. Medical history. Your healthcare provider will start by asking about your symptoms, including the location, severity, and duration of any abdominal pain, as well as any other symptoms such as nausea, vomiting, or jaundice. They will also inquire about your medical history, including any previous episodes of gallbladder or liver problems and any risk factors for gallstone disease. Physical examination. Your healthcare provider will perform a physical examination to assess for signs of gallbladder or liver problems. This may include examining your abdomen for tenderness or swelling and checking for signs of jaundice, such as yellowing of the skin or eyes. Blood tests. Blood tests may be ordered to evaluate liver function and to look for signs of inflammation or infection. Common blood tests include liver function tests, LFTs, which measure levels of liver enzymes and bilirubin, and a complete blood count, CBC, which can detect signs of infection or inflammation. Imaging studies. Ultrasound. Ultrasound is the primary imaging test used to diagnose gallstone disease. It can visualize the gallbladder and detect the presence of gallstones, as well as any signs of inflammation or other complications. Let us see the treatments of gallstone disease. If the patient is asymptomatic, no need for any treatment. Lifestyle modifications are enough. Lifestyle changes. Making certain dietary and lifestyle modifications can help manage gallstone symptoms and reduce the risk of complications. These changes may include eating a healthy, balanced diet low in saturated fats and cholesterol, increasing fibre intake to promote regular bowel movements, maintaining a healthy weight through diet and exercise, avoiding rapid weight loss or crash diets, which can increase the risk of gallstone formation. If the patient is symptomatic. Surgery, cholecystectomy. Surgical removal of the gallbladder, cholecystectomy, is the most definitive treatment for gallstones, especially for individuals with recurrent or severe symptoms, complications such as cholecystitis or pancreatitis, or large gallstones. Cholecystectomy can be performed laparoscopically, minimally invasive, or as an open surgery, depending on individual circumstances. There are two types of cholecystectomies. Number 1 is early or hot cholecystectomy. Early cholecystectomy refers to surgical removal of the gallbladder shortly after the diagnosis of gallstone disease, often within a few days to weeks of the onset of symptoms. This approach is typically recommended for individuals who present with acute symptoms of gallstone disease, such as biliary colic, cholecystitis, inflammation of the gallbladder, or other complications. Early cholecystectomy helps to alleviate symptoms, prevent the recurrence of gallstone-related complications, and avoid the need for prolonged hospitalization or repeated interventions. Number 2 is interval cholecystectomy. Interval cholecystectomy refers to the surgical removal of the gallbladder performed after a period of time following an initial episode of symptomatic gallstone disease. This approach may be considered for individuals who present with mild or moderate symptoms of gallstone disease but do not require emergency surgery. Instead, they may undergo conservative management with medications to control symptoms and prevent complications. Interval cholecystectomy is typically scheduled several weeks to months after the initial episode to allow for optimization of the patient's condition and to reduce the risk of surgical complications. Thank you for watching Nextmeds. Please like and subscribe for more videos and stay connected with Nextmeds for daily videos about health, common diseases, and nutrition.